first showed up at the office one day, and she was complaining of what we call a bobo on her face. So we said, Geraldine, what's up? You've been holding your face there, what's up? You need to go to the dentist or something. She's like, I don't go to the dentist, I gotta go to work. So the next time I saw her, her face had started to sort of go in a little bit. And Geraldine, did you get to the doctor yet? I gotta work. People need me. So I started to kind of ask around, and I found out that she didn't have health insurance. When I saw her again, her whole face had disintegrated because she had cancer and no health insurance. So some of us at work tried to raise some money so that she could see a doctor, but when she finally saw a doctor, it was way too late, and the cancer had spread to her lymph nodes. She actually lived and fought it because she was not about to give up. And she said, this is not going to beat me. I'm going to keep fighting this. But she fought it without the benefit of health care. Had she been able to get preventive care or care even once the cancer was diagnosed, Geraldine would be here today. And she would be saying, stop that crying, Jackie. Everything happens for a reason. So some of her co-workers are behind me, and we honor her. We're here to honor her because her life stands for something. Her life stands for people who are dedicated to others, and dedicated to not just self and what's good for me and what's going to further my political interest. She stood for people who were dedicated to each other and to community and to supporting each other regardless of the sacrifice. So we're here today to honor her and to say that, let us not let the life of people like Geraldine be in vain. We can't bring her back, but we can perhaps save others who are today suffering and maybe dying because they don't have the simple, basic right of health insurance. So for those who are behind me, I'm okay, but and she would say something to make me laugh if she were here, and she'd tell me to go have a cup of tea because she used to make fun of me because I drank tea all day long, and she said it was nasty, but I'm glad to be able to be the one to honor her today.
My story began in 1990 when I had to have a surgery done. I didn't have any insurance. I had to deal with the state hospital. I ended up with pneumonia in both of my lungs, on a respirator for 2 weeks, couldn't breathe no longer than 2 minutes on my own. My doctor told my mother that it can go from bad to worse. Then she got all upset and told him, well, if I had known that, then I wouldn't let you put it on the machine. But I made a turn for the good. I'm here, I'm living, because God had a lot of work for me to do. And a lot of other people could still be here if it wasn't for Bobby Jenner, who's up in that Capitol right there, who got plenty of money, who I know his family, his mother, sisters, brothers, whatever, they got health insurance, so they don't have to worry about it. But he must know what goes around come around. And just like I think he made a statement on TV that he don't like our president, it's not who you like, but we put them in to serve us, to give us what we deserve, not what they want. So everybody can have freedom here in Louisiana and everywhere else. And it's wrong. It's wrong for all of them who want to fight against it. It's a lot of people don't know how they gonna eat or get their meds. I was in that situation. But as of today, I can say because of the Affordable Care, I do have insurance now. I'm able to go to a private doctor, so I don't have to use charity anymore. But I'm not knocking it because it was good, and if I have to go back, I go back. And I just want everybody to just think fall on their knees and pray for them people up there. And let them know that we serve an awesome God. And whatever God say, they cannot knock it.
One of the things that we're here to do is we're here to find the people who need food and bring them food. We're here to find people who have no housing and to bring them housing. We're here to find people who are ill and to provide care for them.
I came out to support the rally and make sure that we know the importance and significance of health care for everyone across the state. And I came out to represent because of the, so much of the political ambiguousness of, the hierarchy here, whereas I think the main thing is the people. Healthcare is something that should be affordable. The right of liberty, life, and the pursuit of happiness is something everyone should have, and I came out to support that. And we're seeing so many lives being lost because of not having the proper health care.
My purpose here today, they asked me to come to give a word of encouragement to those that have lost a loved one and that are hurting or in bereavement and grief. And so I did what God wanted me to do, what placed in my heart, to talk from Matthew's, that 11th chapter, where Jesus said, "Come unto me, all ye that labor and heavy laden, and I'll give you rest."
I came down for the Medicaid expansion rally. We currently have 242,000 Louisianans without health insurance. And the only reason for this is because of Bobby Jindal and the state legislation refusing to take the Medicaid expansion being offered by the government. This not only jeopardizes the people without health insurance, it drives the costs up for all of those who do have insurance, and it drives the cost up for every procedure you have done. And it's just really a spiteful political act that is stupid. A year ago, Bobby Jindal said, "Stop being the party is stupid." Well, Louisiana, stop being the state is stupid. Take the expansion. It's right for the people.
We are here to raise awareness about Medicaid expansion, and we're hoping that our governor would accept Medicaid expansion for the people here in the state of Louisiana.
There are two constitutional amendments before the legislature this session. One is the constitutional amendment that has been introduced by Senator Ben Nevers, and also there's one introduced by Representative Patricia Smith. What these constitutional amendments would do, if the legislature passes them, is it would allow the people to go to the polls this fall and vote on whether or not they think people in Louisiana should be afforded health care coverage, and whether or not they think our state should accept the federal funds that are already available for us to provide that health care coverage to the uninsured.
What disqualifies these people?
They make too little money. Isn't that ironic? It seems kind of backwards, and a lot of my friends, my mother, didn't understand that because it just doesn't seem to make sense. You make too little money to qualify for health care coverage.
The state of Louisiana, they have a lot of people who are uninsured or either underinsured. So how does it help? Either how does it hurt, at least, a lot of people here do not have jobs, and also people who do work, unemployment is very high here. So we have people who are unemployed or either underemployed. So it's hurt Louisiana because many people do not have health insurance. And when people do not have access to health care, it really does hurt our community because people do not have an opportunity to get regular routine exams. And also for those who are critically ill, they do not have a chance to get the care that they need. So people fall in and out of care.
It's important to people in Louisiana because, number one, this is a political game. It's being, a lot of posturing. Governor General doesn't want to accept it because it's, been labeled not the affordable health care, but Obamacare, unfortunately. And we know the political, the little posturing that's going on. But I think, as I said earlier, the wish of the people should be granted to them first. It's the same demographic, the same people who are being dropped through the cracks are members of my church in the inner city here in urban Baton Rouge.
I know what it is like to struggle. I know what it is like to do without. And it's just not right when the resources are there that we decide that some people just don't deserve even the right to have basic health care.
I knew at one time I didn't have health insurance, and it was rough on me. And so I thank God that God blessed me to have health insurance now. But to those that don't have it, oh my God, especially I heard the testimonies. And not only that, but I have a loved one that didn't have proper insurance, health insurance, that passed on. And so if that happened to them, I can imagine what happened to others.
How does the medical community feel about the expansion of Medicare?
There's differences of opinions, but nationally, 10 of the top 12 physician organizations, including the American Academy of Medicine, the American College of Physicians, American Academy of Pediatrics, American Academy of Family Practice, to name a few, strongly support the healthcare law, including, of course, Medicaid expansion.
I would hope that our governor would change his mind and accept Medicaid expansion.
Just for people to speak up and to remember that this is for every Louisianan and not just ourselves personally.
It was a terrific experience to see so many people from every demographic in Louisiana out here tonight, and it was a blessing.
They can contact us through our website. The website is www.healthcare.org. They can go to the Get Involved page and they can send us an email. They can contact us through the website. We want to hear from the public. We want to hear them tell us their stories. We need to hear more stories to put a face on this issue, to let our elected officials and the governor know how this policy decision is affecting people all across the state of Louisiana who currently are having difficulty getting health care coverage.